Okay, let's rip into this. You've thrown a stack of heavy material our way, painting a pretty stark picture of what's absolutely slamming cities across North America right now.
Mhm.
We're talking a brutal mix of homelessness, gnarly drug addiction, and plain old violence is a screwed up tangle that feels completely overwhelming when you just see the headlines or honestly walk through some parts of town.
It's a hell of a challenge, no question. And what jumps out immediately from, all this material is how viciously interconnected these issues are. They aren't sitting off in their own little corners.
Right.
They're tangled together, creating this relentless cycle that's incredibly tough to break free from for the people caught in it and, frankly, for the communities trying to help.
Yeah, exactly. And our mission today, built just for you based on this material, is to kind of cut through that noise. We're diving deep into the data, the research, the insights, not just to understand the shocking scale. I mean, the sheer scale of these crises in Canadian U.S. cities,
Yeah.
but to really get at how they're feeding each other, what the deep down drivers are, and crucially, what the evidence suggests might actually work to pull things apart and, maybe fix this damn situation.
Consider this your unfiltered look.
Yeah.
We're laying out the facts as they're presented, acknowledging just how serious and sensitive this stuff is.
Hmm.
But we'll navigate it with clarity and pull out the real-world details from the material that make it stick.
Hmm.
No dry academic jargon, just the impactful stuff.
All right, let's jump right into the gut punch then, the scope of it all. First, homelessness. The sheer numbers are just mind-boggling.
They truly are. I mean, looking at the Canadian picture, the material tells us over 118,000 different people used emergency shelters in a single year recently.
That's a lot of
Individuals.
Yeah.
And on any given night, you're talking upwards of 16,000 people just in shelters. And the average stay, it's over 51 days.
51 days, that's not a quick fix, is it?
Not at all. That's prolonged instability. Serious stuff.
And that's just shelters, right? The material also points to something called hidden homelessness.
Exactly.
People couch surfing, staying in really unstable situations, which they figure is way, way higher in Canada than those visible numbers.
Absolutely. It means the official counts are just like the tip of the iceberg when it comes to how many people are genuinely struggling to find and keep a place to live.
Okay, so swing over to the U.S. numbers then. What are we seeing there?
Well, the most recent count found around 770,000 people experiencing homelessness on one single night.
770,000, which is frankly insane. That's an 18% jump from just the year before, isn't it?
Yeah, an 18% increase. Highest number since they started counting nationally back in 2007.
Wow. And almost 40% of those people were unsheltered, living outside, in tents, in vehicles. That's a huge chunk right out in the open.
It really is. And chronic homelessness is a persistent, sticky issue in both countries. Around 27% of Canadian shelter users are chronically homeless.
Meaning long-term or repeatedly homeless.
Right, exactly. In the U.S., it's about a third of the total homeless population. And get this, 2/3 of those chronically homeless individuals are unsheltered. These are folks with deep, complex needs that just haven't been met.
And who is bearing the brunt of this? The data shows some absolutely disturbing patterns, demographically speaking.
Without question. In Canada, Indigenous peoples are hit massively harder, like 3 times the rate of the general population. And there's a noticeable increase in refugee claimants and non-citizens showing up in Canadian shelters lately.
And in the U.S., the numbers are just as stark, right? Black individuals, nearly a third of the homeless population.
But only about 12% of the overall population.
Yeah.
Hispanic or Latino individuals are another third, and that group saw a staggering 32% increase in just the last year.
32%, that's huge.
It accounted for almost half of the total U.S. increase in homelessness. Families with kids are also way up, by 39%, impacting over 150,000 kids.
God, that's awful. 150,000 kids.
It's a brutal picture. Though the material does point out one area where targeted efforts have made a real dent. Veteran homelessness in the U.S.
Oh, yeah.
Down by over 50% since 2009. So it suggests that focused, properly resourced programs can work. Senior homelessness, though, that's unfortunately going the other way. It's on the rise.
And looking at specific cities, the material gives us these snapshots of the pressure, right? Like Halifax seeing numbers nearly double.
Yeah, Calgary's rate holding steady but still high. Ottawa dealing with specific demographic challenges. In the U.S., you've got cities like New York grappling with over 140,000 people, L.A. over 70,000.
It's just, and the different ways they count Canada versus the U.S., plus that hidden homelessness, the true scale is probably even worse than these numbers suggest.
Yeah, likely much worse and hard to pin down exactly.
Okay, shifting gears from housing to to health, the drug crisis remains an absolute horror show. The death tolls are just crushing.
They are. Canada saw over 8,000 opioid toxicity deaths in 2023. That's 22 people dying every single day.
22 a day.
Over 80% of those involve fentanyl. And those numbers stayed stubbornly high right into late 2024.
Now, here's a wild difference, right? The U.S. numbers for 2024 are actually projecting a pretty significant decrease in overall overdose deaths compared to 2023.
Yeah, that's what the early estimates suggest. Around 80,000, which is like almost 30,000 fewer than the year before, lowest since 2019, apparently.
That is a notable divergence. Why the difference do we know?
Well, the U.S. data suggests the decline is happening across opioids, stimulants, and cocaine nationally. But, it's not uniform. Some U.S. states and regions are still seeing increases.
Right.
And the regional disparities in Canada, like the crisis in Northern Ontario, they remain incredibly intense. It's not a simple picture anywhere.
And fentanyl is obviously the monster in the room for the opioid crisis in both countries. But the material flags stimulants like meth and cocaine too, and something particularly nasty emerging, xylazine.
Yeah, xylazine, or tranq. It's a powerful animal sedative showing up mixed into the drug supply, especially in the U.S.
And it causes
horrific wounds, like really severe skin ulcers. And terrifyingly, it doesn't respond to naloxone, the overdose reversal drug.
Oh, man.
So that makes the crisis incredibly complex and dangerous to manage. You can reverse the opioid part of an overdose, but not the xylazine part.
Wow. Okay. The material also touches on youth substance use in Canada, right? Worrying rates of vaping, cannabis, alcohol.
Yeah, among students. And higher illicit drug use among gender-diverse and rural youth. Plus, there's this kind of low perception of risk around cannabis and vaping among a lot of kids.
A clear warning sign for future problems if we don't get ahead of it.
Definitely. And cities are often hotspots for this. San Francisco's deep fentanyl issues, high opioid rates in New York State, Philadelphia's struggle with the fentanyl-xylazine mix, it concentrates in urban areas.
This brings us to the third piece of this terrible puzzle, gang activity and violence. And here again, we see some differences in trends between the two countries.
Right. Canada's overall crime rates, including violent crime, actually ticked up in 2023.
Well, the U.S. saw overall violent crime decline in 2023 and continued decreases in 2024 from those pandemic peaks in many big cities.
Yeah, definite divergence there.
But even with that U.S. decline, the material notes things aren't exactly perfect, are they? Aggravated assaults, gun assaults, carjackings were actually higher in 2024 compared to pre-pandemic levels like 2019.
That's true. So specific types of violence are still a major problem, even if the overall homicide numbers are down in many places.
And in Canada, firearm crime still way up.
Still sitting 55% higher than it was just over a decade ago, despite a slight dip in 2023. And gang-related homicides make up a significant chunk, 22% of all homicides in Canada.
Okay, here's a piece that's just frankly disturbing.
Oh.
The material points out that in Canada, the proportion of homicides committed by youth that are gang-related more than doubled.
Yeah, doubled. From 16% in 2022 to over 31% in 2023.
That's a sharp and terrifying increase in kids getting pulled into lethal gang violence. What's driving that?
The material doesn't spell out the exact why for that spike, but it highlights a very specific escalating problem with youth involvement in the most serious end of gang activity in Canada. And gangs themselves are incredibly varied, from street crews to highly organized crime outfits.
The material mentions specific Canadian cities struggling with high crime, often linked to gangs and drugs. Surrey, Kelowna, Sudbury, Winnipeg, Sault Ste. Marie. Toronto also saw a big jump in its crime rate index.
And in the U.S., while some cities got homicides down, others saw assaults tick up. It's a mixed bag.
And youth gangs in the U.S.?
Well, overall, juvenile arrests are down compared to a decade ago, but older data still indicates a substantial presence of youth gangs in large U.S. cities, potentially thousands of gangs, and over 100,000 members reported by police back then. So, still a significant issue.
So, the brutal scope is clear. Overwhelming homelessness, record levels in the U.S., a stubborn and lethal drug crisis, different trends but devastating impacts everywhere, and ongoing gang violence, with that particularly nasty rise in youth homicide involvement in Canada. What screams out from all this data is, well, these are not separate issues.
Not at all. They're feeding off each other like a nasty feedback loop.
Exactly. Which brings us to trying to untangle the messed up root causes driving this whole crisis nexus. These problems aren't random. They're bubbling up from deep cracks in society and some pretty significant system failures.
Yeah, absolutely. Let's talk about those big picture structural drivers first, the societal cracks. Poverty and inequality seem absolutely foundational, showing up everywhere in this material.
It's the bedrock, isn't it? Lack of income, unstable jobs, the growing gap between rich and poor.
This stuff creates instability and makes it damn near impossible to get ahead or even just stay afloat. The material explicitly states that financial factors are the main reason people fall into, and importantly, get out of homelessness. Economic hardship can absolutely push people towards the illegal economy, drug dealing, petty crime, maybe even gang involvement just to survive.
And hand in hand with that is the affordable housing crisis. The material is blunt. A massive shortage of safe, affordable places to live in both countries is a direct cause of record homelessness.
Yeah, millions of households are spending way, way more than they can afford on housing, living right on the edge. Rising costs, especially rent, were a huge driver of the record U.S. homelessness numbers recently.
For low-income folks, finding or keeping a place that doesn't eat up their entire paycheck is becoming an impossible dream.
Pretty much.
Oh.
And unemployment, lack of real opportunity, obviously linked. If you can't get a job that pays a living wage, or if you face barriers, well, things like the drug trade or joining a gang can tragically look like the only option sometimes.
But getting a stable job is also a huge factor in getting out of homelessness.
Exactly. And discrimination is another massive structural piece. The material shows how barriers based on who you are, your race, if you're Indigenous, LGBTQ plus, LGBTQ plus abilities, they compound vulnerability across the board. Housing, jobs, healthcare, the justice system.
Those stark overrepresentation numbers we talked about, they link directly back here.
Right, to these deeply unfair systemic inequities.
So the core point here is that this isn't just about individuals making bad choices. The material makes it crystal clear. These are deeply embedded societal issues, creating the fragile ground where these crises can just explode.
Yep. Any real solution has to take on these massive structures. But beyond the big structures, the material also points to systemic failures, places where the very systems designed to help people are actually letting them down. Or worse.
Like huge gaps in healthcare. That's a big one.
Definitely. Not enough access or funding for mental health and addiction services. Untreated issues are enormous risk factors for becoming homeless.
And are made much, much worse by living without a home.
Exactly. And often, the care isn't culturally appropriate for the populations who need it most, which is another barrier.
The criminal justice system is another part of this vicious cycle, right? Locking people up, often for poverty or drug-related stuff.
Without real rehab or support when they get out. It creates huge barriers to jobs and housing. A criminal record can trap people, pushing them back towards substances or maybe into gangs for survival or identity.
And the child welfare system. A glaring failure point mentioned, kids aging out of foster care with no support network are at incredibly high risk for homelessness.
Super high risk. And those with that history report way higher rates of co-occurring mental health and addiction issues later on when they become homeless adults.
And a particularly brutal system failure highlighted is inadequate discharge planning. People getting out of hospitals, jail, even treatment programs.
With nowhere safe to go. Basically being released directly onto the street. No warm handoff to community services, just dropped. Often undoing any progress they might have made.
It shows how these failures are tangled up, too. You know, child welfare leads to homelessness, leads to the justice system. It just screams for better coordination between systems.
And prevention within them, yeah.
Okay, so finally, let's look at the individual and relational factors. The personal toll and immediate triggers. Trauma and adverse childhood experiences, ACEs, are cited as having a profound, lasting impact.
Huge impact. Stuff like abuse, neglect, chaos at home. The material shows these are strongly linked to later struggles with addiction, mental health problems, getting involved with gangs.
People experiencing homelessness have sky-high rates of past trauma.
It's a foundational element across all three crises, really. And the material stresses you absolutely have to address trauma through trauma-informed care if you want to help people heal.
Mental illness and substance use disorders are obviously critical individual factors, often happening together, right?
Yeah.
Co-occurring issues.
Yeah, very common. They can be both a risk factor for ending up in crisis or a devastating consequence of experiencing these crises. And treating them together is incredibly complex.
Family breakdown and domestic violence, immediate triggers for homelessness, especially for women and young people.
Definitely. And not having that family support can make joining a gang feel like finding a substitute family, even if it's a dangerous one.
And for kids and teens specifically, the material flags early behavior problems and, hanging around with the wrong crowd as key risk factors for getting into gangs.
Often driven by a perceived need for protection, status, or money. Basic needs gifted.
The developmental pathways highlighted are crucial. Many of these really bad outcomes start simmering in childhood or adolescence because of early hardship or lack of support.
Exactly. Canadian data shows people who first became homeless as kids have a much higher chance of becoming chronically homeless adults. It hammers home the absolute necessity of getting in early with intervention and prevention.
Waiting until someone is up in crisis is just way less effective and way more expensive.
So much more expensive. So after looking at this incredibly heavy picture of the scope and the roots, what does the material tell us about what might actually work to climb out of this damn hole? It lays out a bunch of evidence-based strategies.
Okay, good. Let's get into that. For homelessness, the big game changer highlighted is housing first and permanent supportive housing. What's the core idea?
Simple but revolutionary. Get people into housing immediately, with no BS preconditions, like demanding they get sober or enter treatment first.
It treats housing as a basic human right, not a reward you have to earn.
Exactly. Once someone is stable in housing, then voluntary services are offered. And the evidence is incredibly strong on this.
How strong?
It gets people off the streets faster and keeps them housed way more reliably than older approaches. The material points to major studies. One big Canadian study found people in housing first spent 73% of their time housed, compared to only 32% for those who weren't.
Wow, that's a huge difference.
U.S. studies consistently show retention rates between 80 and nearly 90%. It's especially effective for people with the most complex needs and long histories of homelessness.
And what's fascinating and maybe politically significant is that the material shows this can actually save money in the long run.
Yeah, by reducing expensive emergency service, use shelters, hospital visits, jail time housing first can be cost-effective. Some analyses show significant returns on investment.
Examples. Where is this working?
Lowe's mentioned Toronto, various Canadian cities that have embraced it, NYC, Houston, LA's big funding initiatives. Chicago found lower mortality rates for those housed, Seattle. Even the success with veterans using programs like HUD-VASH, which is a type of supportive housing.
But the material is clear it's not a silver bullet, right? It's housing first, not housing only.
Exactly. It requires robust, tailored services available, which can be hard to fund and staff consistently, and the fundamental lack of affordable housing supply makes scaling it up a nightmare.
So you can have the model, but not enough actual apartments.
Precisely. And while it gets people housed, it doesn't magically solve addiction or mental health problems without people actually using those linked services, which are voluntary.
Okay. Beyond housing folks already on the streets, the material stresses prevention and diversion are absolutely crucial and often way cheaper.
Keeping people from becoming homeless in the first damn place.
Yeah.
This includes things like financial aid to help people at risk of eviction. The material shows this can be incredibly cost-effective, high returns on investment.
Programs that help people stabilize when they hit a crisis point.
Exactly. And direct cash transfers are showing real promise.
Giving homeless people cash, how does that work?
One Vancouver study gave folks $7,500, led to way fewer days homeless, more days in stable housing, increased spending on essentials like food and rent, and ultimately saved society money by reducing shelter use.
Interesting. So trust people with resources.
Seems to work in that context. Targeting populations at high-risk youth aging out of care, families facing eviction, people leaving institutions is key for prevention.
And the material also highlights how inadequate social safety nets play a huge role. Income supports are often so damn low, people can't afford housing even with subsidies.
Yeah, financial shocks and just inadequate income drive entry into homelessness. And emergency shelters, while necessary, are often part of the problem.
How so?
Overcrowded, unsafe sometimes, restrictive rules, not really linked to getting actual housing. That pushes people outside into unsheltered homelessness.
So how do we make shelters better?
The material points to guidance emphasizing low barrier access, allowing partners, pets, removing sobriety rules where possible, and crucially, using shelters specifically as a platform for rapid rehousing, connecting people to housing navigators and resources, not just managing them day to day.
Okay. Shifting to the drug crisis solutions. The material lays out a comprehensive approach starting with harm reduction. What's the core principle here?
It's presented as a public health imperative, meeting people where they are, to minimize the damage, the harms, without demanding abstinence first, respecting autonomy.
Supervised consumption sites or overdose prevention centers are a cornerstone here.
Yeah, and the material makes a powerful point. No one has ever died of an overdose inside one of these sites anywhere in the world.
Wow. 0 deaths inside.
The Bureau. Canadian sites have reversed tens of thousands of overdoses. Vancouver's Insight saw a 35% drop in area ODs. They save lives, reduce public injection, connect people to services, and yes, the material shows they can be cost-effective.
Needle and syringe programs, naloxone distribution,
What?
also fundamental.
Absolutely. Proven. Evidence-based tools to prevent disease like HIV and Hep C and rapidly reverse overdoses. Saves lives, reduces healthcare costs. Strong evidence base.
Now, the material digs into some policies that are a lot more complex and frankly generate a ton of debate. Safer supply and decriminalization, especially looking at British Columbia.
Yeah, BC tried prescribing pharmaceutical alternatives to street drugs and decriminalizing personal possession of small amounts. The goals were noble: reduce stigma, get people into services, protect them from the incredibly toxic street supply.
But evaluating it is proving
Sure.
tricky.
Difficult and contentious, yeah. The material presents a study using a specific statistical method that found safer supply was linked to a rise in opioid-related hospitalizations, and adding decriminalization saw those hospitalizations climb even higher, with no clear change in overdose deaths in that analysis.
So, it didn't work.
Well, the study authors speculated maybe destigmatization led more people to seek help in hospitals, or maybe drug diversion was happening. But the material also includes critiques of that study,
Like what?
saying it didn't fully account for the crazy toxic street drug supply at the time. Things like xylazine that naloxone doesn't fix, or maybe changes in hospital practices. And critics point out BC actually saw a drop in overdose deaths after that study's data ended.
Okay, so conflicting signals.
Very much so. And another study looking specifically at people receiving safer supply prescriptions found they were significantly less likely to die overall or from an overdose in the week after getting their script.
So that suggests it helps the individuals getting it, at least.
Right, so you have different studies, different methods, focusing on different things, individual level versus population level, leading to different, sometimes contradictory conclusions.
What's the synthesis, then?
The synthesis here seems clear. Widely accepted harm reduction, like SCS, needles, and naloxone, have strong evidence. Broader policies like safer supply and decriminalization are complex. Outcomes are still being studied and debated like hell. How you evaluate them, the context, it all matters hugely. It's not a simple yes-no answer yet based on this material.
The material also points out that harm reduction needs specific strategies for stimulants, like meth, right, which are a growing problem.
Yeah, things like clean smoking supplies, advising people to go slow, never use alone, drug checking for adulterants like fentanyl or xylazine, even basic health like dental care, which can be affected by stimulant use.
Okay. Beyond harm reduction, treatment and recovery pathways are absolutely vital for opioid addiction.
Medication-assisted treatment, MAT, or MOUD, like methadone or buprenorphine. That's the gold standard. The material shows these medications significantly reduce the risk of overdose death, like by 50%.
Efforts to make these easier to access are highlighted, but a huge challenge the material points to is treating stimulant addiction.
Right. There are currently no FDA-approved medications specifically for stimulant use disorder. That makes behavioral therapies and harm reduction strategies even more critical here.
What about things like drug courts?
Mentioned as effective. Diverting people into treatment instead of jail can reduce both drug use and crime, often at a lower cost. Coordinated city-level responses combining outreach, drug checking, and medication access are also highlighted as crucial.
And the critical need emphasized repeatedly is integration, right? Treatment has to be integrated with housing, mental health care, social supports.
Absolutely, especially for people experiencing homelessness. Treating addiction in a vacuum just doesn't work if someone gets discharged right back to the street with no support.
Okay, finally, let's look at strategies for reducing gang involvement. The material covers prevention, intervention, and helping people get out.
Yeah, prevention and early intervention are about building resilience long before someone is even on a gang's radar.
Risk factors are all over the place: individual, family, school, community. The material suggests school programs alone have mixed results. Like, they might change attitudes, but don't necessarily stop kids from joining gangs.
Some popular ones haven't shown great results on actual behavior, no. What seems more promising, according to the material, are early, intensive, multi-component programs that involve families and provide broad support over time. Comprehensive approaches work better than narrow ones later on.
Community-based youth programs offering positive alternatives, mentorship, Addressing those core needs like belonging.
Can be critical. The material highlights frameworks like the OJJDP Comprehensive Gang Model, which pulls together different strategies: community mobilization, opportunities, social work, suppression, organizational change.
And do these comprehensive models work?
Evaluations, especially when they're implemented correctly with high fidelity, show real reductions in gang violence and criminal activity and help people get jobs or finish school.
Hmm.
So yes, they can be effective.
What about focused intervention? Targeting active gangs and hotspots.
Yeah, this pulling levers or group violence intervention approach, it involves communicating directly with groups driving violence, making it clear violence will have swift consequences, but also offering real pathways to support and opportunity.
And does that work?
Studies show it can be highly effective in reducing gang-related shootings and homicides. Operation Ceasefire in Boston is a classic example with huge reductions.
Other strategies mentioned: Project Safe Neighborhoods, intelligence-led policing, cure violence.
Right. PSN brings together different levels of law enforcement with communities. ILP uses data to target resources effectively. And Cure Violence treats violence like an infectious disease using trained interrupters, often with lived experience. All have shown positive results in reducing violence in various studies.
What's the common principle here?
Seems to be that you have to target the relatively small number of people, causing most of the violence and focus efforts on the places where violence happens most. And success usually comes from combining a credible threat of consequences for violence with genuine, accessible offers of help and opportunity. Law enforcement alone just isn't enough.
Needs robust community and service partnerships.
Absolutely. And then there's helping people get OUT rehabilitation and reentry. The material calls this desistance.
Getting out and staying out, it's a gradual process.
Yeah, often driven by turning points like becoming a parent, getting a stable job, finding a supportive relationship, maybe even just getting older or scared of dying.
Employment and job training are presented as absolutely essential.
Crucial for stability, building a new identity, getting away from crime. But the material acknowledges the huge barriers people face: criminal records, lack of skills, employer reluctance. Programs need to be comprehensive, especially for high-risk youth.
And cognitive behavioral therapy, helping people change thought patterns.
Shown to have a modest but positive impact on reducing reoffending, particularly high-intensity programs tailored for gang members. Helps address the thinking that leads to crime.
So getting out and staying out requires sustained, multifaceted support.
Yep. Address practical needs like housing and jobs, deal with trauma and thinking patterns, help people reconnect positively with society. Those turning points work best when they're supported by programs and relationships that help people build positive new roles.
Okay, so pulling all of this heavy, difficult material together, the overwhelming takeaway seems to be the absolute critical need for integrated solutions. We saw the data showing how common it is for homelessness, mental illness, and addiction to happen together, that trimorbidity.
Yeah, you can't treat them in silos. That demands care that addresses housing, mental health, and substance use simultaneously. Housing First provides the platform, but it needs to be bolted together with really robust health and addiction services, like assertive community treatment teams or integrated clinics.
And innovative models like co-responder teams, police paired with mental health or social workers for crisis calls.
Part of this too, yeah. Treating these fundamentally as health and social issues, not just something for the cops to handle.
And we keep circling back to the big picture. Lasting solutions have to address the root causes: upstream poverty, lack of affordable housing, unemployment, discrimination.
That means massive policy changes beyond specific programs, expanding genuinely affordable housing that's not just market-driven, strengthening income support so people can actually live, fixing universal healthcare access, especially for mental health and addiction.
And taking on systemic racism and discrimination head-on. Investing in kids early is also non-negotiable.
Yeah, this stuff requires a whole of government and, frankly, a whole of society commitment to fairness and opportunity. No single agency can fix this mess. It requires real, committed partnerships.
Between law enforcement, public health, housing, social services, schools, community groups, everyone.
Overcoming the turf wars and different ways of working between these silos is essential. The material highlights the needs formal structures, shared goals, figuring out how to share data despite the hurdles.
And finally, the absolute critical role of people who have actually lived through this, lived experience.
Individuals with personal experience have invaluable insights that policy experts and service providers often miss. about what the real barriers are, what actually helps.
So including their perspectives and how programs are designed, run, evaluated.
Crucial for making sure they actually make sense and work on the ground. Peer support workers, having people with lived experience on advisory boards, co-designing programs with them. This builds trust and ensures solutions are relevant and delivered respectfully. It illuminates nuances nobody else can see.
So we've taken this stack of material, dived deep, and hopefully given you a clearer picture of this incredibly complex and challenging crisis nexus. It's brutal, but the material also points towards tangible strategies with real evidence behind them.
Which leaves us with a powerful question, I think, something for you to sit with after all this. Considering the overwhelming evidence pointing towards what does work, things like housing first, proven harm reduction tools, targeted prevention for youth, genuinely integrated care, why is it still so damn hard to see these solutions scaled up everywhere they're needed?
Yeah.
What are the real barriers, the political fights, the funding silos, maybe even some deep-seated beliefs we hold about poverty or addiction that are holding us back from doing what the evidence tells us we should? A lot to chew on there. Thanks for going on this deep dive with us. Always. We hope this helps you see the forest for the trees in this incredibly difficult landscape.